You have to start over.
So we start over again.
No, it's fine.
Okay.
So was your family always supportive of you?
Yeah, everybody.
Okay.
They thought it was a good profession, and it was something that, at the time there was a lot of jobs. So.
Okay. So who inspired you to do?
Well, Cliff Harville was the pharmacist I worked for, and he was probably the one that I was, from a professional standpoint, inspired me to go into pharmacy.
So, what's the most rewarding part of your job?
Of course, you can make a good living at it from a monetary standpoint, but also just knowing that you make people feel better by what you do, by providing them medications and teaching them how they help them, and about the medicines and how to use them properly, and knowing when somebody walks away that you can tell when they grasp what they're using it for. Sometimes they don't, but when they do, that's real rewarding.
Yeah. So, did you ever have any fears or setbacks during college where you thought, this is too much, I need to do something else?
Well, there was a couple of courses I had to take again to get a higher grade to keep moving on, and but it was one of those things that once I learned to quit playing around so much, I did better, and it might have slowed me up a little bit, but I was determined and I didn't give up. So
okay.
Wasn't always a monetary thing, although I worked all through college, which I think that maybe slowed me up a little bit.
Yeah. Are there any negative things about your job?
Oh, yeah, a lot.
Insurance.
Yeah. The biggest negative thing is dealing with insurance companies. You're the healthcare professional. You've got a patient, but you've got this third entity, this third party that tells you what you can do, what they'll pay you, what to charge the patient, and it's just there's a lot of paperwork and regulations involved with insurance, and that's the negative thing.
Yeah. So is there anything that you know now that you wish you had known when you were my age?
Well, certainly would have tried a little harder initially in school. The first couple of years I played around a good bit, and that affected me long term and how fast I got through. But I got out of pharmacy school, and within a year opened my own business, which I was 27 at the time, which is pretty young, and I might have waited a little bit longer. Now that things have changed so much, you might do as well or maybe even better in certain circumstances working for a major corporation than just working for yourself. So, I don't know, but we've done all right for 24 years, 23 years.
How important would you say networking is in choosing a career, going into a career?
Well, you certainly don't want to just pick one from reading about it. You want to go watch somebody do it. You want to talk to somebody who's doing that as their career. Look at what it takes to get the education required, and then certainly if there's any jobs out there. I mean, if you go to college for 4 years, that's not a real long time, and there's enough forecasts out there where you can tell what the job market's going to be in that particular career, when you get done. So, like pharmacy is a 7-year curriculum now, and 7 years is hard to determine what's going to be going on in 7 years now. But if you go 4 or 5 years, you might see somebody, find what the job market's going to be like. Of course, you never know with recessions and things like that too. So certainly you want to make sure, from an experience standpoint, that's what you want to do, not just from you reading about it in a book or something.
Yeah. What things did you take into consideration when you were looking for a career? Like, was it money? Was it something that made you happy? Was it being successful?
Never really thought about the money part. I liked science and math, so I knew I wanted to do something with science and math. Helping people and talking. I talk a lot, so if talking to patients, was not, was something, whether it was being a physician or a pharmacist or some other thing. I knew it was something like that I wanted to do. The money is nice, but it's not the reason why I did it, which I guess nobody really should do something for money if you think about it, but it does help.
Yeah. So you would say that your job is something that you like to do instead of something that you have to do?
Right, yeah. And whether I work for myself or work for somebody else, I think I would enjoy it.
Yeah. Okay. Is there any other advice that you can give me, just being this age, looking?
Well, the biggest advice would be to make sure there's going to be a market for what you want to do. Like right now, they say it's the worst time to graduate from college because there's just not as many jobs out there. And you certainly don't want to pick a field that there's an abundance of graduates in that particular field, or if that field is dying, due to technology or consolidation or something. So my biggest advice is find something that in 4 or 5 years when you get done, that there's going to be jobs out there, at least from what you can tell now.
Okay. I guess that's it. I don't really know what else to ask you.
What'd you ask Angie?
The same things pretty much. I don't know. I guess you can try. I don't know.